Emily Ice, and I'm going to be discussing the clinical trial duration of antibiotic treatment in community-acquired pneumonia. The background for this trial is the duration of antibiotic treatment for community-acquired pneumonia has not been well established. So to tie this into clinical practice and to make it relevant, let me give you a little background about community-acquired pneumonia. So CAP is the leading cause of mortality and morbidity worldwide. Current IDSA guidelines recommending duration of therapy in CAP are based on expert consensus with only moderate recommendations and level 2 evidence. Shorter duration of antibiotic therapy has many advantages, such as less resistant patterns, improvement of patient-related outcomes that are directly related to the cost of treatments, and there are less adverse effects seen. And without clear recommendations from a clinical trial, controversy about the length of duration of treatment for community-acquired pneumonia will remain. So as far as funding goes, the funding was actually brought forth by the Health Department of Basque Country government in Spain, the Pharmacy Department of the Spanish government, and the Spanish Pulmonology and Thoracic Surgery Society. There was some possible bias seen in this trial. I believe that there was selection bias because the physicians determined the duration of antibiotic treatment in the control group, and there could potentially be some recall bias due to patients being discharged early. They had to actually be taught how to take their own vital signs at home and record those results. So as far as the study question, they're basically trying to see if a 10-day course antibiotics versus a shorter 5-day course of antibiotics would be more beneficial to the patient. And the null hypothesis is there is no difference in treatment of outcome in community-acquired pneumonia related to the duration of treatment. As far as the inclusion criteria for the patient demographics, anybody age 18 years of older and hospitalized with a diagnosis of community-acquired pneumonia were included in this trial. Pneumonia was defined as a pulmonary infiltrate on chest radiography not seen previously, plus at least one symptom compatible with pneumonia, such as cough, fever, dyspnea, and or chest pain. There was a little bit more exclusion criteria. So in order to be excluded from the trial, you had to be infected by the human immunodeficiency virus, be considered chronically immunosuppressed, which would be defined as solid organ transplant, splenectomy, receiving more than 10 milligrams a day of prednisone or an equivalent for greater than 30 days, neutropenia, and then taking another immunosuppressant agent. Those who lived in a nursing home were excluded. If you were discharged from an acute care hospital, an on-site subacute care unit, or a palliative care unit within the previous 14 days. If you had taken antibiotics within the past 30 days before admission, you were also excluded. If you required a longer duration of therapy because of an uncommon cause, such as a Pseudomonas or a Staph aureus infection, you were excluded as well. If you had a chest tubation done that was due to a condition that was complicated by an extrapulmonary infection, such as endocarditis or meningitis, you were excluded. Or if you died or you were transferred to the immediate care unit before randomization.